Hello students. Today, we will be diving into the fascinating and complex world of paraneoplastic neurological disorders. Paraneoplastic neurological disorders are rare but important manifestations of cancer that affect the nervous system. These disorders occur as a result of an immune response triggered by the presence of an underlying malignancy. Throughout this lecture, we will explore various types of paraneoplastic disorders and their associated clinical features, diagnostic criteria, and treatment options. So, let's begin our journey into the world of paraneoplastic neurological disorders. Opsoclonus is a rare neurological disorder characterized by the sudden onset of abnormal and involuntary eye movements. In the context of paraneoplastic disorders, opsoclonus is often associated with an underlying malignancy, most commonly neuroblastoma in children and small cell lung cancer in adults. The pathogenesis of paraneoplastic opsoclonus involves an autoimmune response directed against neuronal surface antigens. These antibodies disrupt the normal function of inhibitory pathways, leading to the characteristic eye movements. Diagnosis of paraneoplastic opsoclonus involves thorough clinical evaluation, including neuroimaging and laboratory tests to identify the underlying malignancy. Treatment typically involves a combination of immunomodulatory therapies and management of the underlying malignancy. Subacute sensory neuropathy is a paraneoplastic neurological disorder characterized by the progressive loss of sensory function in a symmetric pattern. It is frequently associated with small cell lung carcinoma and other malignancies. The exact pathogenesis of paraneoplastic subacute sensory neuropathy remains unclear, but it is thought to involve an immune-mediated mechanism. Clinical manifestations include sensory imbalance, numbness, tingling, and proprioceptive disturbance. Diagnosis is often challenging and requires a thorough evaluation of clinical features, electrophysiological studies, and ruling out other causes of sensory neuropathy. Management involves treating the underlying malignancy and controlling neuropathic symptoms with medications such as gabapentin and pregabalin. Lambertitan myasthenic syndrome, LEMS, is a rare autoimmune disorder characterized by muscle weakness and fatigability. In the context of paraneoplastic disorders, LEMS is often associated with small cell lung carcinoma. The pathogenesis of paraneoplastic LEMS involves autoantibodies directed against presynaptic calcium channels at the neuromuscular junction, leading to impaired release of acetylcholine and subsequent muscle weakness. Clinical features of paraneoplastic LEMS include proximal muscle weakness, autonomic dysfunction, and characteristic electromyography findings. Diagnosis is confirmed by the detection of autoantibodies and electrophysiological studies. Management typically involves immunomodulatory therapy and treatment of the underlying malignancy. Stiff person syndrome, SPS, is a rare neurological disorder characterized by progressive stiffness and muscle spasms, predominantly affecting the axial and proximal limb muscles. In the setting of paraneoplastic disorders, SPS is associated with several malignancies, including breast and lung carcinomas. Paraneoplastic SPS is thought to involve an immune-mediated response against glutamic acid decarboxylase, GAD, an enzyme involved in the synthesis of gamma-aminobutyric acid, GABA. Diagnosis of paraneoplastic SPS requires careful clinical evaluation, electromyography, and the detection of anti-GAD antibodies. Treatment options include immunomodulatory therapies, symptomatic management of muscle spasms, and addressing the underlying malignancy if present. Paraneoplastic retinopathy refers to a group of conditions characterized by visual disturbances secondary to an underlying malignancy. The exact pathogenesis of paraneoplastic retinopathy is not fully understood, but it is thought to involve an autoimmune response directed against retinal antigens. Clinical manifestations include progressive vision loss, night blindness, photopsia, and visual field defects. Diagnosis involves a detailed ophthalmic examination, including electroretinography and the exclusion of other causes of retinal pathology. Treatment primarily focuses on managing the underlying malignancy and providing supportive care. Symptomatic relief may be achieved with medications targeting visual symptoms, such as carbonic anhydrase inhibitors and corticosteroids. Paraneoplastic pemphigus is a rare autoimmune blistering disorder associated with underlying malignancies, most commonly hematologic malignancies and lymphoproliferative disorders. The pathogenesis of paraneoplastic pemphigus involves autoantibodies targeting desmogleins, proteins involved in maintaining the integrity of intercellular adhesions in the skin and mucous membranes. Clinical features of paraneoplastic pemphigus include painful mucosal erosions, blistering, and skin involvement. Diagnosis is established through clinical evaluation, histopathological examination, and detection of specific autoantibodies. Management includes treating the underlying malignancy and utilizing immunosuppressive therapies to control skin manifestations. Paraneoplastic neurological disorders can be associated with a wide range of malignancies. These disorders are often characterized by the presence of specific autoantibodies directed against neuronal antigens. Some common paraneoplastic antigens include Hu, Yo, Re, Ma2, Tr, and CV2/CRMP5. Each antigen is associated with a particular set of clinical features and underlying malignancies. For example, the Hu antigen is associated with paraneoplastic encephalomyelitis and small cell lung cancer, while the Yo antigen is associated with paraneoplastic cerebellar degeneration and ovarian or breast carcinoma. Recognizing these associations can aid in the diagnosis and management of paraneoplastic disorders. Paraneoplastic glomerulopathies are a group of kidney disorders characterized by glomerular injury secondary to an underlying malignancy. These disorders can manifest as nephrotic syndrome, rapidly progressive glomerulonephritis, or other renal manifestations. The pathogenesis of paraneoplastic glomerulopathies involves immune complexes deposited in the glomerular basement membrane, resulting in inflammation and glomerular injury. Diagnosis requires a combination of clinical evaluation, kidney biopsy, and identification of the underlying malignancy. Treatment involves managing the underlying malignancy and utilizing immunosuppressive therapies, such as corticosteroids, to reduce kidney inflammation and preserve renal function. Paraneoplastic pachymeningitis is a rare inflammatory disorder characterized by the thickening of the dura mater, the outermost layer of the brain and spinal cord. This condition is typically associated with underlying malignancies, such as lymphoma or solid tumors. The exact pathogenesis of paraneoplastic pachymeningitis remains unclear, but it is thought to involve an immune-mediated process targeting the dural tissue. Clinical features of paraneoplastic pachymeningitis include severe headaches, cranial nerve palsies, and neurological deficits. Diagnosis requires neuroimaging studies, such as magnetic resonance imaging, MRI, complemented by clinical evaluation and histopathological examination if necessary. Treatment involves managing the underlying malignancy and utilizing immunosuppressive therapies to control inflammation and relieve symptoms. Hyperexplexia is a rare genetic disorder characterized by an excessive startle response and muscular stiffness in response to sudden stimuli. In the context of paraneoplastic disorders, hyperexplexia can occur due to autoantibodies targeting glycine receptors in the central nervous system. This association is often seen with small cell lung carcinoma and thymoma. Diagnosis requires clinical evaluation, electrophysiological studies, and exclusion of other causes of startle syndromes. Treatment includes immunomodulatory therapies and management of the underlying malignancy. Paraneoplastic hypoglycemia is a rare condition characterized by recurrent episodes of low blood sugar levels in the setting of an underlying malignancy. This condition is typically associated with insulin-like growth factor 2, IGF-2 secreting tumors, such as hepatocellular carcinoma and certain mesenchymal tumors. The mechanism involves the production of non-suppressible insulin-like activity by the tumor. Diagnosis is established through a combination of clinical evaluation, laboratory tests to confirm hypoglycemia, and identification of the underlying malignancy. Treatment primarily focuses on managing the underlying tumor and addressing hypoglycemic episodes. Paraneoplastic vasculitis refers to inflammation of blood vessels in various organs in the presence of an underlying malignancy. The exact pathogenesis of paraneoplastic vasculitis is not well understood but is thought to involve immune-mediated mechanisms. Clinical manifestations can vary depending on the organs affected but may include skin rash, joint pain, renal impairment, and neurological symptoms. Diagnosis requires a thorough clinical evaluation, imaging studies, and histopathological examination if necessary. Treatment involves managing the underlying malignancy and utilizing immunosuppressive therapies to control inflammation and prevent further organ damage. Paraneoplastic neurological disorders represent a fascinating and complex group of conditions that can arise in the context of an underlying malignancy. The clinical presentations, pathophysiology, and treatment options vary depending on the specific disorder and associated tumor type. Early recognition and timely intervention are critical for improving patient outcomes. As future medical professionals, it is important to stay informed about these disorders and their management to provide optimal care to our patients. So remember, the journey into the world of paraneoplastic neurological disorders has just begun, and there is much more to explore. Keep learning and stay curious.